All right, guys, well, February isn't just a month for love. It's also a month to take care of your heart. Heart disease is the leading cause of death in the United States, but hopefully with more awareness we can change that. Joining us today from Patient First is Dr. Mark Hippensteel, a good friend of ours from way back when we were on at 7 o'clock. So welcome to the first.
Good morning.
Your first appearance on the Hampton Road
This
Show.
Is wonderful. I mean, it's such a wonderful set you guys have. It's very exciting. Thanks for having me on.
Yeah, it's great to have you back. So a lot of people are surprised when they hear that it is actually heart disease that is the #1 killer and not cancer. Not that these other illnesses don't require some attention, but there's an awareness problem for people with heart disease, especially when it comes to the symptoms.
Yeah, well, the problem with heart disease is that the damage is already done by the time the patient starts having symptoms. And that's why we always stress prevention of heart disease and lifestyle changes. Patients, by and large, they know what they should be doing to keep themselves healthy. Diet and exercise. We always stress that with patients, and they just need to take the time to implement those things in their lifestyle.
When people hear that, though, when they hear things like diet and exercise, you know, they may immediately kind of shrink down and say, well, I don't want to make those major changes. I don't want to deprive myself. I don't want to work that hard. And I'm sure as you were watching Chef Bob load the butter into our etouffee this morning, what are we really talking about here? Are we talking about no good food, no fun, or can you make kind of small adjustments that will pay off big for your heart?
Absolutely. I think, you know, in really stressing to patients, you need to be consistent with slow, gradual changes in your diet, cutting out the fats. Certainly, you know, he's making a wonderful meal, but not every meal you're going to be eating is going to be like that. You have to, you know, certainly, you know, want to eat a lot of fruits and vegetables, cut down on your fats. Salt. The American Heart Association says 2,300 milligrams of salt is the most that you should be having. That's tough to follow. If you actually start reading labels, even if you could cut it down to 4,000 milligrams a day, that would be a big head start. So small changes, but being consistent with those changes is really the key.
Where are some of those places where people might be surprised at how much sodium or salt is in there that people don't think about?
Canned foods, soups, for instance, loaded with salt. Snacks, even sugary foods can also have a lot of salts in them as well, and those are things to also be aware of.
All right, if somebody out there wants to start an exercise program, if they haven't been exercising or maybe never before, what should they keep in mind, and what should they look out for if they're working out and they feel, you know, tired or tightness?
Right. Well, the signs and symptoms of heart disease, you know, and the things to be aware of, certainly I always stress with patients, start with a good physical exam initially to make sure that everything is doing okay, the heart's doing okay, your blood levels of cholesterol, glucose, all these lab values are fine before you start exercising. Taking it from there, slow and steady, nothing that's going to make you exhausted, and a simple, straightforward program that you can stick with and do at least 3 times a week, 30 minutes at a time when you do it.
All right, thanks so much. Good advice, Dr. Mark Hippensteel. We want to remind you, Patient First is open from 8 in the morning until 10 o'clock, 365 days a year at 8 different locations across Hampton Roads. I can tell you my family has taken advantage of this. Nothing like it on a Sunday or a holiday when a little one's not feeling well. So remember Patient First and remember those great tips about how to take care of your heart. Thanks so much, Doc.
Thank you.